Over the last 6 months, as many of these panelists know, I've been working with Congressman Tom Reed, who is my co-chair of the Diabetes Caucus, on what's going on with insulin prices around drug pricing. And what we've learned across the drug chain, the whole drug chain, is that there's a lack of transparency, which we've been talking about a lot in the hearing today. And we've also learned that there's a lot of finger pointing, which we've also seen in this panel today. It's kind of good. It's frustrating to have 11 witnesses, but you hear all of that. And so I want to kind of focus on this issue of the complex web of financial and contractual relationships between the players here, with the idea that maybe we can get to some more transparency, and the ultimate goal being to help the patients. Ms. Riley, I heard you talking about your view of how the market is working in your opening statement, and I agreed with almost everything you were saying, but you left one thing out, and the thing you left out is why the price of insulin is $400 to begin with. Now, I know there's a lot of different delivery systems. There's a lot of different kinds of insulin. We've moved away from the animal insulin. We don't have a generic yet, although that's coming soon, et cetera, et cetera. But some would say it's not just the other players. Pharma has a role in this too. So I want to ask you and two other witnesses a very simple question as we go forward, and that is this. Will Pharma, AHIP, and PCMA each agree to work with your member companies to share information with us about your contracts with other supply chain players, including sharing specific examples of contract terms? Obviously, I don't want to undermine confidentiality, but until we know what the contract terms are, it's really hard for us to get that transparency. Yes or no, Ms. Riley?
Well,
yes or no would work.
I don't have access to those contracts.
Can you work with your members to try to get us that information?
You could probably work independently with them as a trade association. We're not.
You're not going to help.
Be privy
okay, Mr. Merritt, can you help us with that?
Violation of antitrust.
Yes. Okay, and Mr. Eilis, can you help us with that?
Yes.
Okay. Now, I want to. I was listening with great interest to Mr. Guthrie's questions about the PBMs, and I want to ask you a couple of questions, Mr. Merritt, about this, because I heard you say that the rebates always go back to the consumers, but I know from my investigation they don't always go back to the consumers in the form of lower drug prices. Isn't that correct? Yes or no?
Well, yes, in the sense that
Thank you.
No, but we give the rebates to the plans, and then they sometimes.
But they don't always go back in the form of lower drug prices. And so I want to ask you, sometimes the PBMs actually make money off of the rebates paid by the pharmaceutical companies. Is that correct?
That totally depends on the client.
But it could happen, right?
If the client wants that to be that way.
Yes, that answers yes. Now, my understanding is that some of your member clients pass some, but not always all of the rebates onto their insurance or employer clients. Is that correct?
It's determined by the insurer, but
right, that's correct. So that some do, some don't.
100% of the big employers require 100% pass-through of those rebates.
But not everybody, right? Not everybody.
Because they don't want to. No.
Right. That answers yes. Okay. Is it true that PBMs sometimes make money off administration fees paid by pharmaceutical companies that are separate from rebates?
There are different fee agreements, and there are different ways that we have to work.
And so the answer to that is yes, too, isn't it? I'm sorry?
Yes.
Thank you. Now, do your member companies sometimes include price protection clauses intended to insulate PBMs from drug price increases in your contracts with pharmaceutical companies?
They're intended to insulate our clients from.
And so that answers yes, right?
Well, our clients, so I guess it would be no. It's there to insulate our clients from price increases. They want those.
Okay. Member companies sometimes include price protection clauses intended to insulate PBMs from price increases in contracts in pharmaceutical companies. Yes or no?
I guess it would be no.
Okay. Do these price protection clauses sometimes allow your member companies to make additional money through clawbacks when a drug's price increases?
I'm not aware of that. The clawbacks?
Yeah, so if a drug price increases, they can get clawbacks. Ms. Riley, you were nodding.
Oh, I see.
Well, yes, I actually have a document right here, and it states Express Scripts has more than 90% of brand manufacturer contracts include price protection.
Can I get a copy of that? And, Mr. Chairman, I'd like to put that into the record.
And those are very
Objections
popular
ordered.
with
Okay.
clients, too.
Now, Mr. Chairman, as you can imagine, I have many more questions, and I apologize for making you answer yes or no. We have 5 minutes. I'm going to submit these to the witnesses, and